Discussing today's topics from an African American perspective, this is Another View.
Hello, everyone. I'm Another View producer Lisa Godley, filling in for Barbara Ham-Lee. The numbers are frightening. 25,000 people living with HIV in Virginia, 7,000 right here in Eastern Virginia, and 69% of them are African American. So why, in this age of STD awareness and safe sex, are clinics right here in Hampton Roads being bombarded with new cases? And what can we do to turn things around? Joining me now for this very needed conversation is Another View on Health co-host, cardiologist Dr. Keith Newby. Hello, Keith.
How are you?
Glad you could be here.
Thank
again.
you. Always a pleasure.
Also joining us for today's discussion is Dr. Beth Gadkowsky, an infectious disease specialist at EVMS. Thank you for being here.
Thank you for having us.
Alrighty, and also with us, Jerome Cuffee, a peer educator who counsels people once they've been diagnosed with HIV. Jerome, welcome.
Thank you for having me.
Okay, Jerome, I'm going to start with you.
Okay.
Why is it that we're still seeing so many new cases of HIV here in Hampton Roads?
I think part of it is that the young folks think that it can't happen to them. And I think also the influx of technology and social media is another thing that's influencing the numbers. There's a lot of different apps out there that people can put on their phone to let people know how close someone is, like a location, like a GPS location of other persons that may attract them. So I think those things with social media, I think they all contribute to those high numbers.
Okay. Now, you've been living with HIV for 15 years.
Yes.
Could you kind of walk us through your story? You were diagnosed, I think you said, when you were 21.
I was about 21 years old.
Okay.
I had friends that were HIV positive but didn't really know a lot about it. I mean, of course, what they teach you in school, but not really like hands-on of knowing more specific information. At 21, I had a job during that time. I took a physical, excited as a young first job that had benefits. I figured, let me go take advantage of that. And in doing that, the doctor asked me, have you ever had an HIV test? Would you like to take one? And I did that. Didn't think anything about it. But he did tell me if I call you back in 2 weeks for a face-to-face conference that something was wrong. But if I don't call you back, just assume that everything is okay. So no news is good news. I did get that call back in about 2 weeks for a face-to-face meeting. Went in, he gave me the information, told me I was HIV positive, wrote me a prescription, wrote me a referral to go to an infectious disease doctor. Somehow I missed that appointment, and then when I called back to follow up for the appointment or to schedule another appointment, they told me I couldn't, I had to go to somewhere else, that I couldn't go to that facility anymore. So during that time, long story short, I got the prescription filled, started taking the medications, and the medications started making me sick. But knowing what I know now, I know that all the medicines have side effects, and your body has to get used to those side effects and all those things. But back then, being a young kid, I wasn't really familiar with all of that. So I stopped taking the medicine, shoved the pills in the drawer, said, out of sight, out of mind. I feel good, I look good. I'm still young, I'm partying. About 5 years later, and that's when I had my breakdown period where I got really sick. Had to be hospitalized for about 2 weeks and found out that my CD4 count was at 9. So I was very sick during that time. And basically had to rebuild myself. And with the help of the doctors at EVMS, they've been great doctors there for me, and I've been with that doctor ever since then.
Okay. What were you going through mentally when you first learned that you were HIV positive?
It was just so many different emotions, to be honest, from fear to anger, denial, depression, so many different things. It's like the stages of grief. There's 5 stages, and I tell anyone that's newly diagnosed that you have to go through those different stages to get to the acceptance stage and be able to take charge of your life and take charge of what's going on and do something about it. And that's where I am now. And I'm in the field to help others that are going through the same thing.
Okay, great. Dr. Gadkowsky, explain to someone that's listening the difference between, because people always, you almost see it HIV/AIDS. So explain the difference between the two.
We try not to use the term AIDS. This is it's a diagnosis of when your immune system isn't functioning, and usually that's when your CD4 cells, your white blood cells that fight infection, are 200 or less. A normal CD4 count is usually about 350 to 1,200. And again, these are I tell my patients, these are the soldiers in your army to fight infection. And when the virus is out of control, it destroys these soldiers, and it drops really low, and then you get sick. And so the diagnosis of AIDS is when your CD4 count is less than 200, or you've become sick with an opportunistic infection, which is what happened to Jerome. We try not to use the term AIDS because it has a very negative connotation. And a lot of people hear the word and they think that they're never going to be okay again. And we have incredible medications to control the virus. We still can't cure the virus, but I can give you one pill once a day. It can control the virus. Your CD4 count can rise to normal levels, and it's not a death sentence. And a lot of times, folks, especially my patients who hear about HIV/AIDS in the community, they think, "Oh my God, I've got AIDS," and it's a death sentence, which it is not. So we tend not to use the term AIDS when we're talking to our patients. I tend not to say to someone, "You have AIDS." We don't use that terminology, even though you still will see HIV/AIDS. A lot of that comes from that terminology being used worldwide, and that's how it's sort of referred to in the global community. But here in the United States, we tend to use just the term HIV.
Just HIV. Mm-hmm. Now, are there levels? I'm trying to.
There are, and so and it used to be so. A lot of things used to depend on what your CD4 count is. Now, what happens is, regardless of what your CD4 count is, we treat you. We know that it's the virus itself can cause inflammation, and even if your CD4 count, your white blood cells that fight infection, are okay in a normal range, we still know that the virus can be causing trouble. So we still offer folks treatment regardless of what level their CD4 count is. The big distinction we make is 200 or less, AIDS, quite sick. Above that, you don't have an AIDS diagnosis.
Okay. Once someone has been diagnosed, what can they expect as far as their lifestyle to change? And anybody can,
It's variable, I think. And Jerome, go ahead and sort of give us your impressions on that.
I mean, it is very manageable once you get to the acceptance stage. I mean, again, I think that's a very important part because you have to be mentally prepared for the long term. It's a long-term commitment is what I say, what I tell folks with starting the medications, and you can't start it and then decide that you don't want to take it anymore. Once you start it, I mean, it's pretty much there for life, unless there's some cure that comes out. But you have to expect some side effects. I think a lot of the new medications have come out over the last 10 to 15 years, so a lot of the side effects aren't as harsh as they were back in the 80s. So it is very tolerable, but there has been some great improvements, but there's still a long way to go as far as HIV.
Those medications, they vary in cost, or are they affordable? I've heard, because people have asked me these questions, right. So I'm throwing them out to you guys.
So what's really important to know is that even if you're an uninsured or an underinsured person and you're diagnosed with HIV, you never to go without care. There are programs at EVMS. We have a Ryan White grant. It's a federally funded program that was developed in 1991 and named after Ryan White, the young man who had hemophilia in the 80s, who eventually passed from HIV that he had gotten through a blood transfusion. And that federally funded program provides for medical care, and it also has a companion program called the AIDS Drug Assistance Program that provides for medications for people who are underinsured or uninsured. And so you can have no insurance, you can be diagnosed with HIV, and we are a Ryan White provider. You can be referred to us or any of the health departments where we also see patients throughout Hampton Roads. We will see you. You won't have to pay. We'll get your labs. We'll get your medications for you. HIV medications routinely run about $2,000 for a month's supply, and it probably is one of the most expensive medications out there. I think, Dr. Newby, you might know some cardiac medications that might rival that a little bit. But it is an outlay of money that most people cannot afford. So we're really happy to be able to be what's called a Ryan White provider and provide people with care. I do have patients who sometimes lose their insurance and they say, I lost my insurance and I can't get back on the medications. It's important for people to know, if there's folks listening who might be in that situation, we can help you get your medications and get you medical care.
Okay. If you have any questions for our panel, be sure to give us a call at 440-2665 or 1-800-940-2240. We look forward to hearing from you. Dr. Gadkowsky, I remember years ago, and it may not have been that long ago, but the numbers seem to be high in the older population as far as people living with HIV, and now you're seeing a different trend. Could you talk about that?
So a lot of I recommend that everybody, regardless of what your age is, between the ages of 13 to 64, and if you're in medical care, along with accordance to the CDC guidelines, you should be routinely tested if you're a sexually active individual. But where we are seeing a lot of new diagnoses is amongst young people, and particularly in the early 20s to early 30s, closely followed by the folks in the 18 to 24 range.
Wow.
And it's a challenge, and it's frightening, because I want to go into the community and say, please use condoms, please practice safe sex. And I think, as Jerome was saying earlier, a lot of folks don't think it can happen to them. And so that's where we see a little bit of a breakdown. When it happens to them, it's pretty devastating. And it again, it's a lifelong commitment. It doesn't mean your life is over, but it means your life has changed a little bit.
Yeah, you find there's a carefree attitude. Part of the reason why I thought it was important to try to get this message out today is such a carefree attitude towards sex now. You find with the young people that I'm dealing with, it's really like there's nothing to be concerned with. This is just normal behavior. I mean, you're seeing younger and younger kids engaging in sex. I mean, now middle school children, and I do emphasize the word children, and this becomes where, you look at the media, how the media, everything is centered around, sexual activity, and it's almost like it's not that big a deal. So I think a lot of these young kids, and again, you think about I'm a little older now, but at that age, you feel invincible, like there's nothing that could ever happen. And unfortunately, so the reality is, when I came through school, that was back in 1990 when I finished medical school, and I went to Atlanta, which was, one of the HIV capitals of the world at the time. And I think almost every other patient I saw was HIV positive. And it was always fever and a headache and, some issue, shortness of breath. So, lumbar punctures. I could do them in my sleep. We did so many of them. At that time, there was only one drug out, but people died. That was the issue. People died with this problem, and they always think it's no big deal. And I think one of the reasons why it's also important to bring this up is the attitude that people have if they are HIV positive. The sense is that I did, want to make sure we emphasize that if you are positive and you take these medicines, and they'll say the virus is undetectable, sometimes people say, I can go do what I want to do again. And then next thing you know, that cycle starts to pervade, and some people think it's like an antibiotic. You take it for a while, the virus is detectable. I don't need to take this anymore. And next thing you know, they stop it. And I'm just assuming this happens. I know in my area it happens all the time with with cholesterol medicines, hypertension medicines. Once they feel somebody gives them even remote sense of confidence that things are better, all of a sudden it stops. And that was really reason why I wanted to kind of push this envelope today. I want people to understand this is not like something that goes away. You have it. You will always have it. Again, controlled, and it'll keep you alive, but you still are, have the potential to infect other people. And you should not have this carefree attitude like this. It's just no big deal. And that was really a point I wanted to drive home from my perspective, is that you are still at risk yourself and to other people. So that's just something I thought was important to bring out.
Jerome, when you're counseling and you're talking to young people, what are they saying? I don't like condoms. I don't it's not going to happen. What exactly? What are you hearing?
I get mixed responses. Some people, they don't like condoms. I think a lot of it is they don't even know how to use a condom properly. So I go through the techniques of how to properly use a condom and how to squeeze the tip and roll the condom down. Some people are just not educated on how to use condoms. They think they know how to use them, but they really don't. And just recently, I was talking to someone that's even older than me, and I asked them, well, how do you put on the condom? We got into that conversation. How do you put it on? Start from the beginning. And then by the time he finished, I was like, let's start over. like this is not right. That's why it keeps breaking, because you're not putting it on properly.
Okay. Wow. I'm curious because, and this question came up when we were talking before we came and during our morning meeting this morning. When you were growing up, what you learned about sex education, was that helpful at all for you, or how would you change that talk for young people today to make them understand what Keith and Dr. Gadkowsky are talking about regarding, this is your life you're taking in your hands. What would you change about the conversation?
I would make it more personable with people. I'm just thinking back to my childhood, and when I was young, I remember I was about 13 years old when Magic Johnson came out and said that he was HIV positive, when he announced that to the world. Wasn't still really very educated about it. I was in the 7th or 8th grade during that time. Growing up and going through high school, of course we have sex education classes, but I think that it just needs to be more in-depth education about HIV and AIDS, and breaking down, the CD4 counts, the viral loads, and all of those things. Just the education is very powerful in itself. They give some basic information, but I think it needs to be definitely more in depth.
All righty. Let's take a phone call. Vicki is on the line from Virginia Beach. Vicki, thank you for calling Another View.
Sure. Couple of things. One, I was curious with regard to the insurance assistance program. How long can someone actually stay on that? I think the concern sometime with folk is if I get started and they're giving me this medication for free, that they may stop it, and then what do I do? And then the other comment or question, especially to Dr. Newby, you may have seen, it seems that a lot of older adults are having a higher rate of contracting the illness because they also kind of live in a glass bubble thinking, well, I can't get pregnant now because I'm past a certain age, so there's no need to wear protection, but they forget they still have to, protect themselves from other illnesses. And I'll take my comments off the air.
Thank you, Vicki. There's excitement in the room ready to answer that question. Which one do you want to go first?
Well, since she directed me, I'll just throw my first little dibs in there, and I'll let them take the rest of it. I see a lot of HIV in the older population. In fact, right off the top of my head, I have at least 15 people in my cardiology practice who are 75 or older who are HIV positive. I've had family members HIV positive who are older. That's one of the things that you do see. There's a carefree attitude in the older population too. I've had men say they service the neighborhood, and that's the terms they've used with me when they and I've seen that time and time again, that this carefree attitude towards sexual activity again, and part of it may be they think because they're older, like Vicki mentioned, and they can't get pregnant, they don't need to worry about it. But I tell you, at this stage in this world, you got to worry about everything. And I'm 100% in agreement with her. I see it more than I care to see it. But and again, we got to get people past that carefree attitude. One of the issues we run into is when you say, use of condoms. The double-edged sword is, on one hand, you say if you give out condoms, you're almost advocating the carefree sex thing, but if you don't do it, then they contract it, these viruses and these other sexual illnesses. or sexually transmitted illnesses, and you almost say it really has to me, get back into the home environment. I mean, it can't be the responsibility solely of the school to teach sex education. It can't be just the responsibility of counselors who talk to them, because unfortunately he's not going to get to them until after they already have it.
Right.
It can't be the responsibility of just the physicians who see patients in the office. It has that core home environment has to be where it starts, and then everybody else is the kind of helps to drive the message home. But if it's not in the home environment, if that moralistic aspect of what sex really means, and it's not just a carefree thing to just go do because you feel like it, but it was meant for something more than just that. If that core message is not driven home every day, to where you live and how you breathe, how you sleep, and if it's not happening there, it's going to be hard for us as healthcare providers to be able to do it.
Okay.
I would agree with that. We don't talk about sex enough in a healthy way in our society, our U.S. society, and also locally. We, as Jerome was saying, advertising is always sexy. We have these apps that allow us to meet people, to have casual encounters with those folks, and I use that word casual really loosely. And we really don't talk about sex in a way in our homes, in our community, where it's a normal and natural and healthy thing, but you want to protect yourself and others at the same time. And what's really important is, with regards to the condom use, not only are you protecting yourself from HIV as an STD, but also syphilis, gonorrhea, chlamydia. They all come together, and they can affect anyone of any age. And just to go back to the older folks, I have diagnosed a lot of older folks as well, and have many and relatively new diagnoses, but they were probably infected, and perhaps they're 65, but they were probably infected 20 years ago. And so you have to remember that, or 10 years ago. So they may not have presented until they got sick, but the infection actually took place quite a while ago. With regards to the collar and the insurance, the Ryan White program has been in place since 1991. It's not currently going anywhere. What we're working on now is having a lot of patients who are in the Ryan White program sign up for the Affordable Care Act, which is being supplemented by Virginia Department of Health. So this insurance program really isn't going. It's been around for 20 years. It's not going anywhere. And those of us who work with this program will do whatever we can to keep it going, because it's saved a lot of lives.
One comment I wanted to ask, just to throw out there, was do you think that the infection rate of the older population is actually higher than what we know? And the reason I ask that question is that in my practice, and as I'm dealing with patients who are hospitalized for things, when you really think about it, if I have somebody that's 20 years old that presents with some, infection of sorts, or some presentation that doesn't seem typical, characteristically, we're going to think about HIV and probably would test. But you get an older patient, who comes in with some illness, you're going to typically think other things first. So that HIV test may never be performed or thought about, because that's not the characteristic standard way we're taught to think about who's going to have this illness. So I actually kind of wonder if these numbers that we're hearing are actually less than what we know. And if you look at the reality of people out there who may have it and they don't know they have it, I have this sneaking suspicion that it's a lot higher than what we expect or think.
Okay, if you're just joining us, we're talking about the alarming numbers of new HIV cases in Eastern Virginia, in fact, in the state of Virginia, and the fact that about 70% of the people who've been diagnosed are African American. I'm joined by Dr. Keith Newby, another View on Health co-host, as well as Dr. Beth Gadkowsky, an infectious disease specialist at EVMS, and Jerome Cuffee, who counsels people once they've been diagnosed and who's been living with HIV since 2001. If you'd like to be a part of this conversation, give us a call at 440-2665 or 1-800-940-2240. Dr. Gadkowsky, I had a question for you. You were talking about people living with it for 10, 20 years before, they even came into a point for treatment. What is that doing to your body in the process? What are you seeing by the time that happens?
So, what happens with the virus when you're initially infected? Your body is able to control the virus. It's not able to kill it, to cure it, but it's able to keep it under control. And in most people, after having it for between 7 and 10 years, your body's ability to keep the virus under control breaks down, and your CD4 count drops quite low, and you become sick with what are called opportunistic infections. They're infections that don't affect normal individuals. I like to use the term, they take the opportunity to kick you when you're already down. And so they're things that we don't see in folks who might show up in the hospital with an infection who are not HIV positive. And so a lot of times, and I'll let Jerome speak to this because this is sort of what happened. This is what happened to you, right?
Yes, it is. But a lot of those infections, like she said, for example, PCP pneumonia, MAC disease, a lot of those different things start to happen once those CD4 cells drop below 200.
And it can take 3 years for that to happen, but in the majority of people, it will usually take 7 to 10 years without treatment.
Yes.
Now, once somebody says, I need to get tested, what's the process? Where do they go? What are some of the services?
There's lots of different agencies in the area, ASOs, or AIDS service organizations, or CBOs, community-based organizations that provide HIV testing. The test can be done orally, where it takes 15 to 20 minutes, or it can be done with a finger stick, where we get a little sample of blood from you. And from there, once we find someone that's positive, we automatically link that person into care. We call the doctor's office, go ahead and set up the appointments, and then we follow them throughout that process. So a big push for Virginia over the last couple of years in the National HIV Aids strategy that came out in 2010 with the Obama administration is to not let people fall through the cracks anymore. It's to hold their hands once they find out that they're HIV positive and help them and get those other support services that they may need, like mental health, substance abuse, because all of those things are going to affect them mentally and the HIV as well if they're not stable. So that's a big push, and there's a new strategy that came out that was released this year, and that plan is getting us to 2020. So that's the new HIV AIDS strategy released from the White House this year.
Okay, I need some advice to people who are embarrassed to talk about either being HIV positive or starting that conversation about being tested with somebody that they might want to be intimate with. Is that you, Jerome?
Yeah. Well, Jerome probably does it more than I do, but I think we both do. It's called disclosure.
Yes. Yes, but just the fact that people getting tested together or people just initially getting tested in general. A lot of the information, we've been putting a lot of social media ads out, we do basic street outreach where we're walking the streets, knocking door to door, putting flyers on people's doors, and letting people know that we're in the community, so that they can come to a private setting where they don't have to feel like they're going to the health department and they're going to see someone that they know when they walk in, or those type of things. There's so many different issues why people don't come in and get tested, but we try to make it now accessible to them. There's mobile vehicles that go out into the communities and park on the corner and just, wait for people to come up to the vehicle to get tested. So there's a lot of different avenues for people to get tested.
What about the reliability of the over-the-counter tests that you see in the? Are they? Because I know people are going to want to know those, because sometimes people just don't even want to go out because they know somebody's scared, somebody's going to see them. Mm-hmm. They're tipping around corners, saying, that's why the phones aren't ringing as much on this show, because I know people, I'm saying that jokingly, but right. I know realistically that's why people don't call in much, because they say, I want to listen.
Well, exactly. And the thing is, that's one of the reasons that we're here, is because there does not need to be this stigma around HIV. This is, Dr. Newby, you were saying before that you have family. I have family that's positive. I have friends that are positive. This is something, that I do professionally. It's a passion. But it's also something that I have in my personal life, and I think that the majority of us do as well. And we need to talk about it, and be open to it, and realize that this is something that affects everybody, and it is not something to whisper about, behind closed doors, because we really need to support, those who are positive, in addition to helping support those decrease their risk for becoming positive.
I'm going to throw this at you guys because these are things that I've heard. What do you say to the young lady or young man that says, "I love him, I love her. I don't know how to ask them. Should I say, let's go get tested together? What are you saying? How do you say? What do you say to them? How do you advise them? What would you say to them?"
I mean, if a person is really afraid of getting tested, I always encourage them to bring someone there with them that's going to support them, no matter what, whether the result is negative or positive. And that's a big thing for newly diagnosed individuals anyway, is just to have someone that's going to support them and have that support. I know a person that's newly diagnosed that is in her 50s, and she has children, she has grandchildren, and she's terrified of telling her family. She's afraid what type of response she's going to get from her family, so she doesn't tell them.
But she needs that support.
Yes, and she needs it.
And how important is that support?
It's pretty important. But I do have a lot of patients who will not disclose their status to their family because they feel it's their business. And usually what I tell people is that the only person that you need to tell is someone that you're going to be intimate with. It's actually a law to really reveal your status to a sexual partner prior to intimacy. But a lot of people choose to go about handling the HIV diagnosis a different way. And that's why we work really hard to provide folks who are newly diagnosed with mental health support, because it can be a very tough time. And sometimes families are not supportive.
Yeah, I was going to ask about that because I know, and I thought it was an extremely important point about the mental health part. I've seen people get extremely depressed afterward, and in fact, almost suicidal as a result of that. And then I've seen the opposite, where they get mad at the world and want to go out and try to affect everybody else. Because I have it, so I guess let me just have this carefree attitude about it. So nobody told me, so why am I going to tell somebody else? So, I mean, I think, again, that mental health piece is extremely important. How much, just out of curiosity, how much depression and those types of things do you see as like routine or very common?
It's routine. National numbers put it usually at greater than 50% of folks who are HIV positive are suffering from some sort of depression or mental health diagnosis. I think that 50% of Americans probably are anyway. Just to throw that out there. But it is something that always is a significant issue. It's hard. I mean, this is a hard diagnosis to be given. And as Jerome was saying, it's just I tell my patients, so you're going to go through the stages of grief. And hopefully one day you'll be at peace with this, and you'll know that this doesn't rule your life. This is a speed bump in your life. This is something that doesn't define you. It's something that you're living with, and living a wonderful, happy, healthy life. And really, you can with HIV. You can get married. You can have children. I have many patients who are in what are called serodiscordant couples, where one individual is positive and one individual is negative, and they're making it work. And that happens all the time. Sometimes people will say, "Oh, I'm positive, no one will love me again." That's not true. It's not true at all. And when we give people the benefit of the doubt, you may be surprised at their response to you when you say to them, "This is something that I have." And they may say, "I don't care, I love you anyway." And that happens more often than we like to talk about, or that we're able to talk about.
Yeah. What is the recommendation about sexual activity? If you have a married couple,
yeah, because I'm real curious about it.
Yeah. Well, this is a hard one.
How that works.
This is a hard one. I don't know. So what happens? So we recommend condoms all the time. So one of the things that we do emphasize is something that's called treatment is prevention. Okay, and this is where folks who are positive, our goal is to get folks into care, get them on meds, and have them continue in care. And that's the continuum of care is what that's called. And this is part of what Jerome does, is trying to get people into care and have them stay in care. Because once you're in care and you're on your meds, the amount of virus that's in your bloodstream decreases. Our goal is to have it be what's called undetectable. And when you're undetectable, your risk of transmitting that virus to someone else is really low. I can't tell you that it's zero, okay? But I can tell you that it's really low. And so, for instance, in Europe and in Switzerland, if you're if you have a partner and you're one of you is positive, one of you is negative, and your viral load is is undetectable, they say you don't have to wear condoms, okay, because they feel that the risk is so low. We are not, Switzerland. We are the United States, and so we still recommend that you use condoms, even though you're undetectable, but it does reduce the risk. There is something that is called pre-exposure prophylaxis, or PrEP, and I'm going to let Jerome talk about that, actually.
So PrEP is one of the medications that is actually used to treat HIV for HIV positive patients, and it is used now as a prevention method. It was approved, I want to say, almost 2 years ago by the CDC. So now the HIV negative person can take this medication, and it prevents them from being positive, with the use of condoms, of course. So it doesn't substitute condoms, but it is another prevention method of reducing the risk of catching HIV.
So you went on to say have children.
Yes,
so
most certainly.
So does that pass on
it can
to the
be.
child?
So no, it won't, it's not usually passed on to the child. So we're a lot of places where we're using PrEP, pre-exposure prophylaxis, is in couples who are, one is positive and one is negative, and we may give it to the negative person to help so that they can actually have sexual intercourse to try to produce a child with the negative partner being on this medication so that it reduces their risk of contracting HIV. Okay. Usually what we do recommend is, a lot of times we do recommend to be 100% is something that's called sperm washing if the male partner is HIV positive, or in vitro fertilization type methods, or intrauterine insemination. But this PrEP is opening up sort of a whole new world for couples who are undetectable and want to try on their own. It's still not 100%, but if we talk you through it, it's something that certainly can be done.
Is that more in the person, say, like if you have, and I'm going to make this assumption, is that more a treatment or preventative strategy in someone who, say, the partner that has the virus, they need to be undetectable, not full-blown or
you got it.
Yeah.
Undetectable.
Okay.
Absolutely. I would not advocate that for anybody who is not undetectable and taking their health seriously.
And I know that seems like a very intuitive question, but I mean, I've seen stranger things happen. I want to make sure everybody heard that. I already knew the answer to that, but I want to make sure people understand that, they will sit there and just take it. I'm fine. Right. You may be full blown, to the nth degree, and I know I'm going to be fine if I take this, and then go ahead and do what I want to do. So I want to make sure people heard that and understood that. That is more for certain specific situations and not just a global use.
You got it. Yes.
Keith said a term, and the interns, we were talking about that before we came in, the term full-blown.
Yes, we don't tend to use that term.
Because I was about to ask what the difference is.
Right. Because, we all know. So Dr. Newby trained at a time when the term full-blown AIDS was used all the time, and
the age catching up with me.
It's okay, and that's okay because I will have people come to me and say, "Oh, I have full blown," or somebody has full blown. And I say, "Okay, let's just take that out of your vocabulary. What we say, you're sick, your counts are low. We're going to get it under control. We're going to get it better." And I just we try to be as positive, as positive as possible because. It's really, this is something that we can treat. This is something that we can help fix. This doesn't have to, ruin someone's life or define them or but there are people who, honestly though, let me tell you, there are people who are still dying from AIDS or complications thereof.
Okay. Let's take a call. Joanne is on the line from Newport News. Joanne, thanks for calling Another View.
Yes. Years and years ago, I happened to pay a visit to our local ER, not because I needed ER services, but I was in to pick up a friend. And in the doctor's sleeping area, there was a poster on the wall that the CDC had put out, and it was a visual of all of the various sexually transmitted diseases. It was an appalling poster. It's very frightening. And the sad part is that with the HIV, there would have had to have been a box down at the bottom with no visual in it because it is a hidden thing. You can't, there's no visual that you can spot on yourself like the old days with some of the sexually transmitted diseases. And that's what I think makes it so tragic and so frightening for many of us. So I just wanted to make that comment.
Thank you so much, Joanne. We appreciate that, because I have been meaning to bring up, I interviewed Magic Johnson a couple years ago, and to me, and of course I'm not a physician, but to me he looked healthier than when he was playing ball. He's a mountain of a man, but he did not, there was nothing, me looking at him, there was nothing about him that would have made me say, this man is HIV positive. Nothing.
And
So,
that's a true reality of it doesn't have a look or it doesn't have a face anymore. And I tell audiences all the time that, you know, when you're with your partners, you have to think, what if this person is positive? Because you can't look at them and tell if they are or not. You have to treat everyone as if they are.
One of the things with Magic Johnson I always wondered was whether or not he was really truly a true diagnosis. Was that a false positive diagnosis? Because it's one of the few people I've ever seen, especially at that time he was diagnosed, to contract it. Right. And I mean, again, I was in his personal life, but you never heard about him being sick or ill or anything.
No, because right around the same time Arthur Ashe passed away.
Exactly.
He passed away about a year after Magic Johnson revealed his status. And this is the thing: is that the virus doesn't affect everybody the same way. Yeah. And for some people, you can progress from HIV with a good CD4 count to a low CD4 count relatively rapidly. Okay. And there are people who are actually called long-term non-progressors, where the body is able to control the virus. Okay. And everybody's a little bit different. And I do have patients who probably were diagnosed in the mid-'80s and didn't get on good treatment until probably 1998 or 2000 and did okay for those 15 years in the interim. And it really affects everybody quite a bit differently.
I know it's a stretch, but physical fitness, do you think that plays any factor with how you tolerate this virus? I mean, I know it may be a difficult question to ask or answer, but I was wondering, when I look at somebody like him who had been playing ball his life, just really physically fit, versus somebody who, their biggest activity is pushing a remote control button. Whether or not there plays any factor with how you tolerate this virus.
Yes, I mean, physical fitness is very important. It's important for all of us, no matter what our health status is, but especially with HIV, it is important to be physically fit. I know some side effects of the medication, or for some people, they gain weight. They end up gaining weight, so that's another whole issue, because you're dealing with other diagnoses like diabetes and things like that. So those are things that you have to be alert and be aware of as well.
Okay. Wow. Okay. I have a question for you about this support system. As a caregiver of someone that has HIV, or as a family member, what should you know? How can you help? What's your role?
That's a bit of a loaded question.
That is a loaded question. I think for starters, though, that everyone needs to know the ways that it's transmitted, because I still hear some clients tell me that their family members that do know have them use paper plates and plastic forks and paper cups to drink out of, because they don't want to use the same dishes that the person that's positive is using, which I think is really sad.
I know it is.
Because we're in 2015 now, and there's a lot of information out there. But the 4 body fluids that HIV is transmitted through blood, of course, semen, breast milk, and vaginal fluids. So as long as that person is not coming in contact with any of those 4 body fluids, then they're not putting themselves at risk. So I think that's the first thing that family members need to know is how it's contracted, and then how to care for that person. That would be next. Did you want to chime in on that one?
Yeah, I have the same question, and I often encourage patients to bring family members so that we can do education during our visits. Not only educating the patient, but also educating about those things like the paper plates. I hear that all the time, and I feel like we're back in 1988 again when I hear that. But also just understanding how the virus works, again, how it's transmitted, and that you can hug your your family member, that's okay. You can kiss them. You can, you can spend significant time with them. But also sort of just be there, I think, and be accepting. And I think I have patients who've been kicked out of their house when a parent finds out they're positive or a family member finds out they're positive. Or they're not, Thanksgiving's coming up. They're not allowed to come to Thanksgiving with the whole family because they're positive. And so I do think that for family members, parents, siblings, friends, folks who are positive, it's important to learn as much about the disease as you can. Get educated. Don't be naive about it. Don't be ignorant about it. And just be open and accepting because this is something that affects so many people. And I promise you that everyone knows someone who's positive and they just don't know it.
Right. We've got about a minute left, and I wanted to ask you all, are we anywhere close to a cure?
There are some really promising new therapies that are out there. Problem with HIV, it's a really smart virus, and every time we try to develop a vaccine or a therapy, it has a way of outsmarting all of our attempts. I think that the biggest way we're going to cure this is by people getting tested, and I would like people to get tested even if they don't think they're at risk. Okay, I think that's important. I think doctors in the community should offer these tests, regardless of whether they think the patient is at risk or not. And also to really have an open and honest conversation about this, kind of like what we're doing today. And I think that's how we're going to defeat HIV.
And on that note, thank you so much,
Thank
Dr.
you.
Beth Gadkowsky. Thank you. Jerome Cuffee, you had one quick thing you wanted to say.
I just wanted to add one thing, that I was at a convention in D.C. It was a couple years ago. It's a NASDAQ conference, which is a national, state, and territorial directors where they choose someone from each state to represent. And there was someone from the White House that was there. He spoke about the 80s versus now. And he said when this disease first came out, it was a gay disease, a white gay male disease. But now it's African Americans that it's affecting the most. And it's going to take for someone to get mad, get organized, and do something about it to stop it. So I just wanted to get that point in.
Thank you so much. And Keith, of course, thank you for being here.
Thank you.
Thank you.
In America, there is a lot of attention directed toward our children and their education. There always seems to be stories in the news about whether or not a school is accredited or how a child's test score, what their test score is, or what we can do to end the dropout crisis. So imagine how you might react if you visited a country where roughly 83% of the school-aged children didn't even go to school. I recently spoke to a local man who is determined to turn things around for the children of Uganda. Taking photographs is Nadere Johnson's passion, but 8 years ago, his lens took him on a journey that would give him something else to adore.
I was blessed to travel to Uganda, East Africa, for the purposes of doing mission work. But once there, I saw a little girl who really, really, really stole my heart. When I first met her, she was 1 year old. It was at a clinic, and I stooped down to take her picture. And she started engaging with me because everything that I would do, she would reciprocate. And so we ended up having a choreographed routine. I was blessed to come back the next year. And when I came the next year, she really stole my heart. And so I unofficially adopted her. So I've been her sponsor for the last 7 years, and my life has never been the same.
As a result, young Esther flourished. Nadere and his wife found themselves not just supporting Esther, but soon her entire family.
When I went last summer, the blessing that I was giving this little girl, God put it in my heart to try and bless other children. So once I came back, I spoke to my wife about it, and she was in agreement that it was definitely a worthy cause. They have over 2 million children are orphans, and a lot of it is due to AIDS, but regardless of what it's due to, the fact is, though, there are still over 2 million children who are orphans. You have 1.76 million children who are as part of the child labor. And so that's one of the highest rates in the world. 1.76 million children are not going to school. They're out working, and a lot of it has to do for survival.
Within a matter of months, the couple had formed their own nonprofit, which they named Operation International Gift of Knowledge.
Our mission is to serve by providing children suffering from extreme poverty with access to their medical, nutrition, and educational needs so they may be able to discover their God-given talent. Our children go to boarding schools, so we're able to take care of their education, we're able to take care of their medical needs, and we're able to take care of their nutritional needs by them staying at the school.
Since Nadere and his wife Michelle can't be there all the time, they've partnered with Cassandra Miracle Center, a church in Uganda. Volunteers at the church take care of the orphans and send them to school. Nadere says their dream now is to have others become sponsors.
The top development economists have said one of the most effective ways to address extreme poverty is to have one sponsor to one child. So that's what we're trying to do.
So for less than the cost of a date night at the movies, you can take care of the child's education and their room and board for a month.
We're asking people, when you do invest financially in the child, don't let that be the end of it. We also want you to invest love in the child. And so we would set you up with an email for that child. You would be able to email the school to find out how that child is progressing. We will give you a post office box to be able to send gifts to the child.
About 13 children are currently being served by Operation International Gift of Knowledge, and the ones who have been in the program for a while are doing extremely well.
The children I saw, they're becoming pretty fluent in English. They're very outgoing now, and I can see where their self-esteem has risen. They know that outside of Uganda, there's people out in the world that are rooting for them, that care about them.
For Another View, I'm Lisa Godley. If you'd like to recognize and support people living with HIV and would like to help raise awareness, you'll want to be a part of Getting to Zero. It starts with an AIDS awareness conference on December 1st and ends with a Terrence Affer Anderson production called Railings on December 11th. For more information about Getting to Zero, log on to our website at anotherviewradio.org and click on events. And on next Saturday, November 28th, the performance art Teens Testing will be held at the OK Spark Gallery at 801 Bush Street in Norfolk from 2 until 3. Our theme music was composed and performed by Jay Sennett, and I'd like to thank producer Danny Epperson, who so graciously filled in for me. Victor Bowen is our audio engineer, and Justin Dents answered our phones. Next Friday, the Another View crew takes a holiday, but we'll be back December 4th with a lesson in etiquette. Have a wonderful Thanksgiving, everyone. Barbara will be back behind the mic in 2 weeks when we get together again for Another View.